Perfect. Well, like Renee said, I'm David Bayne. I'm the director for Thurston County's Public Health and Social Services Department. It is an honor to be able to spend a few minutes with you guys today. We are in the midst of recruiting for some pretty significant positions for the county. Thurston County Board of Health is looking to expand its current membership, and we're looking for uh, three different categories of members. I will describe the Board of Health and its role first, and they'll talk about what those categories look like for membership. And then I will turn it over to Chelyn Sowers, who will cover the other board that we're looking to fill. And then after that, we would love to have some open time for folks to ask any questions, get any clarity. This is really a point where I'm viewing this almost like an open house concept where we can have a dialogue as needed. So I'll start with the Board of Health in Thurston County. So at its core, the Thurston County Board of Health oversees efforts to improve the public's health by providing leadership, shaping our health department's policies and programs. From a practical perspective, this board has the power to enforce many of our public health regulations and statutes. It also provides leadership when it comes to the hiring of a health officer. It also does things like establishing fee schedules for our public health permits. All those things I know sound really exciting and great, but I think at a high level, the board does more than just perform these sort of routine functions. This board is also really responsible for setting the vision for Thurston County when it comes to public health. So I'm excited to work with a board with people who are inspired and motivated to do more for our county, particularly for our citizens who are struggling. I think this is an opportunity for those who are interested and really getting an opportunity to sort of help set the direction for how we do our work. For those of you not familiar with public health, our scope is very, very broad, which is something I love about this role, and means that my job is never, ever dull. At a really high level, we perform a couple of key functions for the county, some that are unique to Thurston and some that every jurisdiction across the state does. So we have services ranging from our communicable disease work, which involves everything from doing the data assessment to surveillance and education to working with our on our opioid response issues. We've got our child, family, and community wellness programs, where we've got the bulk of our nurses who do work with like home visitation, work on child death reviews, working on prevention work involving things like chronic disease prevention. We also have environmental health within our purview, which covers, again, a really broad scope of work, everything from septic permitting and inspections and drinking water to food services and restaurant inspections to hazardous waste and pesticides, to doing things like pollution identification and groundwater cleanup. It's a really wide spectrum there in EH. Unique to Thurston, we also have a couple of other functions, including our Office of Housing, which provides a lot of leadership and funding throughout the county for affordable housing and really trying to take on the issue of houselessness in our county. We also do work with emergency preparedness and work on the treatment sales tax program, which is something that I will let Chelyn talk about when she's got a turn to speak. And we also do work with our veterans in our county. There's a Veterans Assistance Board attached to our department, and developmental disabilities. We have some work there as well. So you can tell we cover the gambit. So if there's an issue you can think about in health and public health that interests you, we probably have it here. And as a member of the Board of Health, at some point, one of these topics, if not all of them, will come before you, and it will ask for your recommendations and your advice and your perspective on issues. As a director, I'm really looking forward to, again, like having partners with me as we seek to better the health of this county. Okay, so getting to the nitty gritty a little bit about what we're looking for. So there's 3 categories by law that we're looking to seat for the board. So there are already existing members that have to be seated by the board, and those are our elected officials, which are our county commissioners. We also have an elected official representing a city. Right now, that's the city of Lacey. We also have a spot for a tribal member, which we're currently working on filling. And that leaves us with multiple positions for community members, which is where you all come in. So the 3 categories we're looking to fill. The first, these are not in any priority order, just the way that I've kind of listed them out. The first is looking at folks who are really working in our healthcare arena. So someone representing our provider community. We're also looking for folks who are have lived experience, who are directly impacted by public health issues. So these are folks, you don't have to have a degree, you don't have to have some kind of specific job. It's just we're looking for someone who actually has lived experience and can provide that perspective to the board. It's so important for us to be able, with boards like this, to have people who are on the ground, who have lived experience that actually relates to the work that we're doing, and not just from a distance moving forward. We're also looking for someone who represents kind of the community stakeholder at a broader level. So we've got one for public health providers, for healthcare providers, one for someone who, again, is someone who is a county resident who has faced lived experience or significant health inequities. The final one is for someone representing the broader community at large. This could be someone who is a business owner, a teacher, someone who represents a community organization. So we're trying to really cover the gamut here of the county and the kind of folks you want to see represented. If you are interested, the deadline for applying for any of those roles is next week. It's next Wednesday. I'm going to have Renee drop into the chat the link to a document that will help you sort of get access to the application. We are really hoping to have this process wrapped up, like I said, the deadline of next week, and then the current Board of Health will review the applications in December. And so we are looking to have folks start in January. One of the things that we're looking for as part of the process for those applying, we are looking for a commitment of 8 to 10 2-hour meetings per year. So it's not like a heavy weekly commitment, but we do have monthly meetings of the board. And then we've also established some subcommittees that folks can serve on as well. And we're looking at folks serving a staggered 3-year term. So it's a 3-year commitment, 8 to 10 2-hour meetings per year, roughly one meeting per month, with the potential for special meetings or subcommittee meetings as well. So with that, I will stop my spiel here and hand it over to Chelyn to talk about our other board.
Thanks, David. Hi, everyone. My name is Chelyn Sowers. I'm the Behavioral Health Fund Program Manager for Thurston County Public Health, and I'm excited to be with you virtually here this afternoon. The Behavioral Health Fund, also known as Treatment Sales Tax, TST, is a 0.1% sales tax collected here in Thurston County. So TST is a local funding stream that works alongside federal and state funding, such as Medicaid, to meet mental health and substance use needs here in the county. So TST funded programs, they serve individuals with behavioral health and or substance use challenges, including people that are involved in the justice system, veterans, youth, and families. Programs funded with TST, they aim to reduce justice involvement, emergency room use, healthcare costs, public assistance, and there's quite many other goals as well from TST. In terms of
I think we maybe lost Chelyn. I'll give her just 1 minute to try to come back on and restart. In the meantime, I will maybe add a couple more details to my part. So I noted that the Board of Health will be trying to do, or we'll be doing interviews for candidates in December. I'm going to give you the exact date for that, actually. December 12th is our next Board of Health meeting. Those meetings are traditionally held starting at 4:30 in the afternoon. Or sorry, at 4 o'clock in the afternoon. And then we'll looks like we maybe have, let's see, a couple of questions. Interviews won't be super complex or complicated, but it will be live. So we will ask people to come to the board interview in person. So that will be part of the interview process. For those of you on this call, if this is not something that you can commit to yourself, that's totally fine. Part of our motivation for having this group come together was to also have a broad outreach. So spread the word to your networks. If you know of folks in any of those categories, community stakeholder, lived experience, healthcare provider, please get the word out to folks in that one. And again, I can't emphasize this enough. As a board, I really want to reflect the community that we live in. We want it to be a board that has diversity, not just with visible diversity, but also lived experience diversity. And yes, Keely, this is one of the things that I'm still trying to nail down with the county is confirming the compensation part. It's something that we've been having dialogue about with county leadership. And when we get confirmation on that, I'll make sure we send out a note to this group and others as well to confirm that. Chelyn.
Hi, I'm so sorry. My internet completely dropped right as I was speaking.
No worries.
If I continue on?
Go for it.
Okay, awesome. So I cut off right when I was talking about they're serving a staggered 3-year term, and we generally meet about once every month. So TST programs, they serve individuals facing behavioral health challenges and people in the justice system. And we know that BIPOC, people living with disabilities, individuals experiencing homelessness, veterans, LGBTQA+ individuals are disproportionately represented in these systems. And for all of these systems, great way to get involved.
Oh, Chelyn, I think we're losing you again.
Oh. Hear me now?
I can hear you right now, but it was kind of cutting in and out. If you're talking now, we cannot hear you. No worries. Renee, I was gonna say if you've got the kind of last part for Chelyn in terms of like the things for folks to know, I'll hand it to you to kind of cover that, the last part.
I was going to say I could just summarize a little bit of what TST Advisory Committee is seeking right now. They're looking for Thurston County residents to serve on their board, someone that is able to commit their time about 8 to 10 times per year and serve a staggered 3-year term. And they essentially provide advisory recommendations of how to spend funds for behavioral health and substance use disorders and treatment assistance. And then they primarily make non-binding recommendations to the Board of County Commissioners regarding the use of treatment sales tax funds. So the application for the Treatment Sales Tax Advisory Committee is also through the link that I added into the chat. And the deadline for that application is noon on Friday, December 1st. So it's a little bit longer time for the treatment sales tax rather than the Board of Health application. But that's about all we have in terms of descriptions and application processes for both these boards. And so we can open it up now for questions. Feel free to put them in the chat or raise your hand, and I can read through the ones in the chat. But if you guys have any questions, also raise your hand as well.
We clearly did a real bang up job here of explaining this, so no questions. I also wanted to note, not to put them on the spot, but I wanted to note that we also have a new manager for our county's racial equity work, DB Ogden, who's also on this call. And that position is also a role I think that will see a lot of connection with both these boards, and making sure that we are aligned with where the county is heading when it comes to our racial equity work. So a little shout out there to DB.
You totally put me on the spot, but I look forward to helping both boards and PHSS with your vision and mission. So thank you.
Thank you. Okay. If there's no other questions, Renee, I was going to say, folks can have the link in the chat. Chelyn left a contact info for her in the chat. And really looking forward to sort of seeing the candidates come through. I'm excited about being part of this process and looking forward to working with a great group of folks going forward.
I actually did just get a question now that we're wrapping up, but someone had asked if it's a problem if they work in the criminal justice system, if that's a conflict of interest.
For TST, I believe, and Jen, you can jump in too. I don't believe that there's a conflict unless you're a recipient of the funds for TST.
Correct. Not a conflict of interest to sit on the TST advisory committee, but if there is a vote coming up that might fund a particular program or service that is underneath that realm, then you could abstain from that vote.
Thank you.
That's correct. Hopefully you can hear me.
Yep. Thank you. We did. I have a question from Steve here as well about the size of the board. Yeah, so this is actually what sparked this whole thing, to be honest, was because the county is adding 2 new commissioners. By law, we have to also expand the Board of Health. The law wants to require a balance, that there's not more elected officials than community members. So whenever we add elected officials, we need to make sure that we're adding community members. And so I'm actually really excited about the fact that we get to expand our community kind of input for this one. So it's definitely a positive. And a question from Garrett about, yeah, I think it could be. This could be beneficial, having a peer counseling certificate. I think the board is ultimately the one's going to make the choices about who's a good fit. But I think a good case could be made for having experience in that arena. And I think that also could also count towards I think any of the categories, frankly, that background there. I think you kind of hit the jackpot with that background. It could be either of the 3 categories, really. Yeah, no problem. Any other questions for folks? Okay. This is not the end. Like I said, you can reach us. Let us know if you have any more questions. But hopefully, like I said, if this is something you can commit to, please share with folks that you think can. That would be great. All right, Renee, I think I'm good on my end.
I agree. Chelyn, was there anything you wanted to add before we end?
Nothing else. Just thank you all for being here. Thanks.
Yes, thank you again for everyone who was able to join this afternoon, and I hope you guys all have a good weekend. Thank you.